Welcome back. We are answering your questions about the coronavirus with Cone Health's Chief Physician Executive, Dr. Bruce Swords. Thank you again for being here. Remember, you can text your questions to 336-379-5775. So, Dr. Swords, during the break, we got a couple of questions about how this virus is transmitted and if people need to worry about getting it through their eyes.
Good question. The main mode of transmission, as far as we know, is respiratory, so inhaling it from someone who coughs or sneezes. We do also believe that the virus can be transmitted through mucous membranes, so by touching your eyes, the nasal mucosa, perhaps the mouth, that the virus can be absorbed that way as well. And yes, you can get it that way.
And what about asymptomatic carriers, people who are not showing symptoms? Is there any new evidence that they can transmit COVID-19 to other people?
Yeah, I think there's good evidence that people without symptoms can transmit the virus. And so those folks, some of them may be completely asymptomatic through the course of the infection. So they're infected, they just don't feel it. There's also a belief that people can transmit the disease a day or two before they get ill. So maybe pre-symptomatic people can transmit the illness. We're quite certain that that happens.
And as the temperatures continue to rise, Dr. Swords, many people wonder if that high heat can kill off the virus.
Again, we don't know. It would be great. So there's some thought that maybe the coronavirus could be something like the virus that causes influenza. We don't have evidence of that really, and we have seen this virus in both the northern and southern hemisphere at the same time. So none of us are really holding our breath expecting that to really happen.
Someone texted in, if I test positive, how long will it take me to fully recover?
You know, this disease is so variable in its expression. There are people who may not have any illness, some who are mildly ill, and there's some people who are critically ill and recover even though they were close to death. So people who are that sick, it could take weeks and months for them to get better and regain their strength. From the common illness point of view, those of us who might get mild to moderately ill, you can expect to be ill for 5 to 7 days, and it may take 2 weeks for you to fully recover.
So someone else wants to know about symptoms, and have health experts seen any new symptoms or changes in symptoms since the pandemic started?
The more we learn about this disease, the more unusual symptoms we might begin to understand. But again, for the vast majority of us, we will have flu-like symptoms with fever, aches and pains, perhaps loss of sense of smell or taste. Those will be the common symptoms, a cough. The symptoms that are less likely, headaches, maybe GI symptoms. Some of us will experience those, but fewer of us will.
Interesting. Another question about masks, especially in light of the new mandate going into effect in Greensboro tomorrow. They want to know if people have asthma or they have a tough time breathing with a mask on. What's your recommendation? What should they do?
Yeah. Again, the request or mandate is wear a mask when you're in public. You can take a mask off when you are in your private home or perhaps in a private office. And so I think the real way to get around that is to spend less time around people. That's hard to hear, but people with asthma and other chronic illnesses might be at more risk of having severe consequences of COVID anyway. So all the more reason to stay away from each other and stay inside.
And for those of us who have been out and about, been to stores perhaps and seen those plexiglass or plastic shields up, someone wants to know if those actually help limit the spread of the virus.
Good question. The answer is yes, we think so. So the idea is there's a physical barrier between um, the person who works for the retail store and the customer, and there's just harder to transmit the illness across a physical barrier. We do things similar in our healthcare facilities by wearing not just a mask, but a face shield as well, acts as an additional barrier between someone who might have the disease and others who don't.
And another question about testing, someone asking, how long does it typically take to get those test results back?
Yeah, another good question. So many of these answers are it depends. So we do have tests that really we can get the results back in 15 to 30 minutes. There's some problems with those tests, but used appropriately, they can be valuable. We have excellent testing within Cone Health where we can get reliable results back within an hour or two, and then other testing that might take 4 to 6 hours. And once in a while now, we still have to send out tests to a commercial lab that could take 24 to 48 hours to get back.
Dr. Swords, thank you so much for being with us this evening, and thank you for your questions.